Wegovy's heart protection approval is real, but it is not a blanket heart shield. The FDA did not approve it for every adult carrying extra weight. Wegovy, semaglutide, applies to a narrower group, adults with known heart disease and overweight or obesity. That detail decides who should ask, who should wait, and who should not assume benefit from headlines. It is narrower than it sounds. Many people hear heart protection and think primary prevention. Primary prevention means trying to stop a first heart event before one has happened. This approval is mainly about people already on the other side of that line. A prior event or proven artery disease changes the risk level. Weight alone does not prove that same heart risk. High cholesterol, high blood pressure, or family history can be serious. But those risks are not the same as a prior heart attack, prior stroke, or diagnosed artery disease. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. The medication acts on a hormone pathway that affects appetite, fullness, and blood sugar signals. That means it can change hunger and weight through body signals, not willpower alone. It also helps many patients lose weight, which can reduce strain on the heart. The study behind the approval tested whether Wegovy could reduce major heart events. Those events were heart-related death, non-fatal heart attack, or non-fatal stroke. Non-fatal means the person survived the event, but the event still counts as serious harm. The trial result flips a common assumption. Diabetes was not required. Many viewers connect semaglutide with diabetes treatment. In this study, adults had overweight or obesity and established heart disease, but they had no history of diabetes. That matters because the heart result was not just a diabetes story. The benefit was not simply explained as better diabetes control. The drug appeared to lower major heart events in people with proven heart disease and extra weight, even without diabetes. The heart protection claim is an adult question first. Wegovy is not known to reduce major heart events in people under 18. Weight treatment in children and teenagers is a separate question, not the same approval. The studied group was specific. Participants were at least 45 years old and had a body mass index of 27 or higher. Body mass index compares weight with height, and it is used to classify overweight or obesity. The study enrolled more than 17,600 adults. Everyone had existing heart disease. Examples included prior heart attack, prior stroke, or symptomatic peripheral artery disease. Peripheral artery disease means narrowed arteries outside the heart, often causing leg pain with walking. The result was meaningful, but not absolute protection. Major heart events happened in 6.5% of people taking semaglutide, compared with 8% taking placebo. Placebo means an inactive comparison treatment. The practical meaning is fewer events across the treated group, not guaranteed safety for one person. A 20% relative reduction can sound larger than it feels. Relative means the reduction compared with the placebo group's rate, not a 20-point drop for each person. The safer interpretation is lower risk in a matched high-risk group. Risk reduction works across groups, not as a visible shield around one patient. One patient may avoid an event, another may not, and nobody can know that beforehand. That is why the person should closely match the group actually studied. The trial followed people for about 40 months on average. That gives more confidence than a short weight loss study. But more people stopped semaglutide than placebo because side effects can make long-term treatment difficult. The common side effects are not small for everyone. Nausea, vomiting, diarrhea, constipation, stomach pain, fatigue, and dizziness can occur for some people. Some patients stop treatment because symptoms interfere with normal eating, hydration, or daily function. Chest pain, stroke symptoms, or sudden shortness of breath still needs emergency care. This approval is about long-term risk reduction, not immediate rescue. Do not wait for this medicine to work during urgent symptoms. There are also warning situations. People with a personal or family history of medullary thyroid cancer should not use Wegovy. This is a rare thyroid cancer. People with multiple endocrine neoplasia, type 2, An inherited condition that causes hormone gland tumors should also avoid it. Safety still has to match the evidence and the person. Wegovy should not be combined with other semaglutide products or similar gut hormone medicines. These medicines act on appetite and digestion signals. Overlap can increase side effects without a clear added benefit. Evidence also has to match the disease history. Extra weight plus worry about future risk is not the same as established disease. A scary family history is different from proven disease in the person taking the medicine. A person may still qualify for Wegovy for weight management without fitting the heart protection group. That is not a failure. It simply means the reason for using the medication is different. Different reasons require different expectations. The practical decision starts with medical history. The clearest candidate is an adult with overweight or obesity and established heart disease. The question is not just how much weight you carry. It is what your medical history shows about your arteries. Ask about history first. Was there a heart attack, stroke, stent, bypass surgery, or symptomatic leg artery disease? A stent is a small tube used to open a narrowed artery. If no such history exists, the heart protection claim needs more caution. Proof can come from different records. A catheterization report may show blocked heart arteries. A discharge summary may confirm a heart attack or stroke. A vascular test may document leg artery disease. These details matter because the approval depends on documented disease, not worry alone. For some people, the missing piece is not weight or motivation. It is documentation. A doctor may need to confirm the actual diagnosis and the event date. They may also ask whether artery disease is still relevant to today's treatment decision. That is different from an old vague note. This does not make other risks unimportant. It means the approval should not be stretched beyond the group studied. Stretching the label can make patients expect a heart benefit that was not actually tested in them. After urgent symptoms are separated out, routine prevention returns to daily risk control. Wegovy is used with eating fewer calories and increased physical activity, not as a replacement for them. Heart risk is shaped by medication, food patterns, movement, smoking, sleep, blood pressure, and cholesterol together over time. That foundation can include blood pressure control, cholesterol treatment, diet counseling, statins, smoking cessation, sleep apnea care, and safe exercise when appropriate. Wegovy may be one layer in that larger plan. The approval adds a tool. It does not erase the foundation. Do not hear this approval as Wegovy protects every heart. Hear it as Wegovy may reduce serious heart events in adults with known heart disease and overweight or obesity. A precise label protects people better than a bigger headline. If you are asking about this approval, bring your actual heart history to the visit. Bring prior hospital records, stent history, stroke history, medication list, and recent labs. The best decision starts with facts, not a headline. Wegovy's heart approval targets a defined high-risk group, not universal heart insurance. The label is not a slogan, it is a clinical boundary. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.